Well, it's time for Medical Monday on NBC 26. Joining us on Wisconsin Tonight is Dr. Stephen Schmidt of BayCare Clinic to talk about the advancements in plastic surgery. Thanks for being here.
Sure, it's my pleasure.
And you know, when we think of plastic surgery, we think of nose jobs, getting a breast augmentation, all those fun things, but there's a lot more to it than just cosmetic.
Sure, when we think of plastic surgery, it's a larger term than just cosmetic surgery. It includes non-cosmetic surgery, things that we think of in terms of reconstructive, as well as repairing problems that children are born with, breast reconstruction, all sorts of things. We do hand surgery, just a lot of different things besides cosmetic surgery, but we also do a lot of cosmetic surgery.
And it's an important thing too. Sometimes something cosmetic can also be very functionally important too.
Sure. There's a lot of patients that really have issues with aspects of their body following weight loss surgery, other problems that they have that really affect their self-esteem, as well as the way that their clothing fit, the comfort that they have, their ability to exercise, all sorts of different aspects of their lifestyle that are really helped out by having some surgery.
And I think when we think of plastic surgery, some people might think it's super expensive, their insurance might not help. If someone's thinking about it, what should be their first step?
Well, if they're thinking about plastic surgery, of course, the first thing they should do is go and talk to a board-certified plastic surgeon. And that's very, very important. There are a lot of people out there that do cosmetic surgery, some of which are qualified to do that, some of which aren't. But there's a great amount of patient safety and confidence that they can have when they see a board-certified plastic surgeon. The other thing that ideal patients for cosmetic surgery or plastic surgery should be generally in good health. We think of that in terms of physical problems that they may have should be well controlled, things like diabetes and hypertension, heart disease. On the other hand, they should also be emotionally or psychologically prepared for their surgery, meaning they understand the risks of the operation. They understand that there will be a recovery because although these are surgeries that people look forward to having and should be fun, they are real operations, and they at times have pain and so forth afterwards and do have a period of recovery. So they need to be prepared for those things and be pretty stable emotionally so that they don't have problems after surgery.
And one thing, for people who are worried about the cost, you can make it affordable for different
there's a lot of different surgeries that we used to have to do in the operating room, and that involves a facility fee and anesthesia fees, and typically that doubles or triples the cost of the operation. A lot of those now we're able to do very, very comfortably for patients in the office, and it makes a lot of the procedures that we do surprisingly available and affordable for just about everybody.
Right. Like anything, it's easy. You can ask and find out the info to see if it's right for you, right?
There's no harm in asking. Yes, you're right.
Well, thank you so much for being here.
Thank you.
And for more information on anything you want to know about plastic surgery, you can visit BayCare Clinic on the web. You can call this number on your screen, and we also have all the information that we talked about today on our website, NBC26.com. Just look for it on the Wisconsin Tonight tab under Sections.